Ay, wala pa. Magandang araw po muli. Pagpatuloy po natin ang ating pag-aaral sa TCM. Ang ating pong topic ay Jing Essence. Number 6 na po tayo. From Lamp Aku Wellness Foundation, Inc. Essence as basis for 3 treasures. A healthy mind depends on the strength of essence. So, stored in kidneys and chi produced by stomach and spleen. Mind is dependent on pre-heaven and post-heaven essence. So yung ating kaisipan ay depende daw po dun sa lakas ng mga enerhiya na nasa ating kidney at ang ating mga kinakain. Na ito nga yun yung dinadigest ng ating spleen stomach. So triad of essence, chi, mind is often expressed in Chinese medicine as heaven, po yung mind, person as chi, earth as essence. Corresponding to 3 organs. Heart, kasi siya yung namamahala sa ating mind. Stomach, spleen, para sa ating postnatal chi. Kidneys, respectively, para sa ating pre-heaven chi. Yan. So, yung po ano? So, yung mind, sa under siya ng heart, siya yung heaven. Ang chi ay stomach and spleen sa person. So, yung essence naman, si kidney, siya yung earth. So, in practice, make a general assessment of relative state of these 3 fundamental substances as essence, give an indication of inherited constitution. So, yung essence paano? Kung ano yung mga namana natin, siya yun. Yung nagiging katawan natin, pagkatao natin, itsura natin. So, yung chi naman gives indication of state of produce from day to day. So, yung mga kinakain natin, siya po yun. Mind give indication of state of emotional and mental life. So, yung ating pag-iisip, ito yung nagsasabi kung ano yung kalalagayan ng ating pag-iisip sa ating utak, mental life. So, a state of essence can be deduced from patient past history of serious childhood disease would indicate weak constitution. So yan, malalaman po natin kung yung kalagayan ng essence ay healthy. Kung nagkakasakit po siya nung maliit pa lang siya, ibig sabihin po nun, mahina po yung hindi healthy yung essence. So pulse with scattered or leather. Quality indicates poor and weak essence. Nararamdaman din po sa pulse kung scattered. Nagsasabi na weak yung essence na nasa kidney. Pag tinignan naman natin ang tongue, shows weak essence kung wala itong root o no spirit. So, parang yung tongue na walang kabuhay-buhay. State of mind can be deduced by observing luster of eyes. Yung kaya pag tumingin tayo sa tao, 'di ba, makikilala natin kung parang walang masyadong malamlam ang mata, ibig sabihin po noon, eyes with luster with certain unfeignable shine and vitality about them show healthy condition of mind. So kung malamlam yung mata, ibig sabihin, yung state of mind, may disease. So nakikita po sa mata. Kung healthy, ayun nga yung sabing parang may kisap. So eyes that look dull as they have a curtain of lids in front of them show that mind is disturbed. Observed in those who have had serious emotional problem for a long period of time. Kaya minsan tinititigan natin yung mga tao, yung parang hindi makatingin sa'yo ng diretso, parang wala, ang layo ng tingin, ang layo ng iniisip. So, siya po yun yung mga have had serious shock even if this occurred many years previously. Lalo pa yung hindi pa nakaka-recover ng mga masasakit nilang nakaraan na naapektuhan talaga yung kanilang puso, yung kanilang utak. Nakikita sa mata, malamlam. Ito po yun. Sa Tagalog, malamlam. So, function of kidney essence. It determines growth, reproduction, and development. So, it is the basis of kidney chi. So, it produces marrow. It is the basis of constitution. It is the foundation of the 3 treasures, essence, chi, mind. Yan po yung function ng kidney essence. How your kidney organ meridian system. So, sign of kidney energy and balance. Kung balance po ito makikita natin, healthy fluid regulation. Tapos feeling energetic with lots of vitality, yung mga masisigla. Ganun din, strong bones, healthy libido. Yan. Healthy hearing. Meron pong mga tao na kahit may edad na, ang lakas, ang ganda ng pandinig, kahit malalayo, naririnig nila, hindi sila nabibingi. Ibig sabihin, yung kidney essence nila, yung kidney energy ay balance. So, sign of kidney energy imbalance, pag imbalance naman po, ito yung laging may frequent urination. Kaya pag nagtatanong tayo sa mga pasyente natin, ihi po ba kayo ng ihi? O, may imbalance po yung kidney. So, prone to fatigue and feeling of weakness. Konting galaw lang, konting lakad lang, napapagod. Imbalance po yung kidney energy. Mild joints, aches, and pains. Madalas may mga kirot, konting galaw, konting trabaho, ayun, may kirot. Tapos, reduced sexual interest. Wala nang gana. Mild dizziness. Yung other po, irregular periods, sa mga babae po, tapos yung mga hindi nakakatulog, tapos nagkakaroon ng night sweats. So po yan ang sign of kidney energy imbalance. Okay. So ayan po yung ating mga drawing. Makikita nyo sa bata, slow growth and development children. Yung parang ang bagal-bagal nilang lumaki, tapos yung right height nila, hindi nila agad naaabot. So may problema po sa essence deficiency. Tapos premature hair loss, mga bata pa lang, nawawala na ng yun, shaggy ang tawag diyan, shagilid ang buhok. Yan. Kakaroon po ng problema sa kidney essence. Premature gray hair, naku ngayon napakaraming bata pa lang, mga mapuputi na ang buhok. Pero syempre marami pong dahilan din yun Bone loss, ayun, yung nagka-carb na yung likod. Mga kahit hindi pa matanda minsan nagkakaroon yan. Pero pag sa mga matatanda, dahil humihina na nga po yung kanilang kidney, kaya nagkakaroon na ng bone loss. Memory loss, ayun, madaling makalimot. No libido and fertility issue, wala nang gana. So po yan ang essence deficiency na nakalagay sa ating kidney. Thank you po.
Thank you very much, Ma'am Mildred. Punta naman tayo ngayon sa tongue diagnosis. Let's listen to Ma'am Rowena Agatha Manglapus. Rama in short.
Yeah. Hello po.
Good afternoon po ulit.
Good afternoon again.
Okay. Topic is still on tongue body shape.
Okay, let's do it. Tongue diagnosis 105. Okay, so let's talk about the tongue body shape. The shape of the tongue includes the tongue's size. Remember, it's a size. The physical shape, whether there are cracks on the surface, and the length and mobility of the tongue. So we'll look at everything about the tongue. Okay, take note of everything. The tongue shape will mainly reflect whether there is a shu or shi condition. The tongue shape will give an impression of the condition of qi and shu, meaning blood, as well as whether wind and dampness are present. The shape of the tongue will also reflect the severity and duration of the imbalance. A pale, wet tongue that has arisen due to yang shu is less serious and indicates a shorter duration than if the tongue is pale, wet, and swollen. The swelling of the tongue indicates that the yang is chronically weak and therefore not performing its function of transforming and transporting fluids in the body. Similarly, yin shu that manifests with a tongue that is red and without coating is not as serious and chronic as yin shu that manifests with tongue that is red, thin, lacking in coating, and with cracks in the surface of the tongue. The latter shows that the yin shu is so deep-rooted and chronic that it is starting to damage the body's tissues. Even though the shape of the tongue is highly significant, it is still the tongue color that is the single most important aspect in tongue diagnosis. Let's talk about a thin tongue body. A thin tongue refers to the thickness and not the breadth of the tongue. So if you take a look at a piece of paper, hindi yung size ng masusulatan, but it's the thickness of the paper. A tongue becomes thin when there is too little fluid and too little shu to fill the tongue. For example, there is too little yin in the tongue. This will be due this will be due to there being too little yin and or su in general, or there being something that has damaged these yin aspects, which will be some form of heat. The color of the tongue will be the determining factor. So the redder the tongue, the more heat there is. So there you go. So let's talk about these two tongues. The first one is long, right? So again, you take a look at the size, the shape, the color, the coating. Take a look at everything, right? So the first tongue is kind of long with some teeth marks, and take note of the color. At the sides, there's some redness, right? But I don't know if it's shiny or just white. And then the other one, it has a depression sa may heart area, right? So take a look at maybe may heart chi deficiency siya, but the tongue is wet. So again, take a look at all the factors, right, na nasa tongue, cracks and all, color. There you go. And we also take a look at the underside of the tongue. You know, you can ask your patients to, um, you know, ano yung tip of the tongue sa palate or sa top sa upper teeth para makita nyo yung ilalim if there's some indication of what do you call this? Stagnation, blood stagnation. Okay. Although we don't have it in the pictures, but you'll know kasi kitang-kita yung vein. So that's blood stagnation. Masyadong kita yung vein sa ilalim na violet or gray. So a red tongue indicates that there is heat damaging the yin aspects, and a pale tongue that there is too little su. A thin tongue is not seen as often as might be expected. Many clients are su, and yin su, but because they also have dampness and phlegm, this results in their tongues being swollen. So it's not very often that you see very thin tongues because there are other aspects that might be involved. This means that a tongue that would otherwise have been thin due to su or yin-su can be swollen due to the presence of dampness and phlegm. So although there is blood deficiency or yin deficiency, pero if there is dampness, it won't show up. Ang more na magsho-show is the presence of dampness and phlegm. Therefore, it's going to be a bit thicker. So let's talk about a swollen tongue body. It is necessary to distinguish between a tongue that is completely swollen and a tongue where only certain areas are swollen. So you have to take note of a lot of things, right? A swollen tongue will be the result of too much fluid accumulating in the tongue. For example, dampness, phlegm, or accumulation of fluids, which is the opposite of the previous situation where the tongue was too thin due to a lack of fluids. The accumulation of dampness, phlegm, or fluids in the body is in itself a Shi condition. Shi conditions will often, though not always, have their root in a Su condition. Heat, for example, can force fluids upwards to the tongue or condense them so that they transform into phlegm. So as with the color of the tongue, the swelling can encompass the entire tongue body or just be limited to a certain area that corresponds to specific organs or areas of the body. So let's take a look at the tongue in the first picture. So it's kind of red, right? But the other one on the right, not really pale, but I think there is a white coat, and it's very shiny, almost buttery, right? So there's a kind of phlegm there, but if the color is white, there's cold as well. Okay, pa. So let's take a look at this one. So it's a partially swollen tongue. Whilst an entirely swollen tongue will be due to a Shi condition of dampness, phlegm, or accumulated fluids, a partially swollen tongue can be a sign of a Su or a Shi condition. Chi Su, Chi stagnation, and heat can all result in the swelling of certain areas of the tongue. The areas of the tongue that most often swell up are the tip, the central area, and the edges of the tongue. So in my case, I often see swollen yung mid part, yung middle parts, stomach and spleen areas, and sometimes the edges for the liver gallbladder area. But I haven't really seen a tongue like this in my practice. So if the sides are swollen, it is important to differentiate between whether it is the whole side of the tongue that is swollen. So that's going to be a liver imbalance. Remember, the sides are liver and gallbladder thing, right? Areas. Or just the sides in the central area of the tongue. This is what I'm talking about, the spleen chi su. So these are the two common things that I often see. If the swollen sides are also red, this indicates liver heat. If they are normal in color, there will be liver chi stagnation. The reason that spleen chi su can result in swelling of the sides of the tongue, which is an area normally associated with liver and gallbladder area, is that when the spleen area is in the middle of the tongue's is that when the spleen area in the middle of the tongue swells, this forces the side of the tongue outwards in this area. So it pushes the swelling outside to the outer part. So spleen chi deficiency swelling will usually result in there being teeth marks on the side of the tongue. So that's where the teeth marks come in. So if there is a phlegm dampness or chi deficiency in the lung, there will be swelling of either the whole or the front third of the tongue or just the sides of this area. The tip of the tongue can swell when there are heart imbalances. Remember, the tip refers to the heart. This will typically be seen if the mental emotional aspect of the heart, the shen, is not in balance. The tip will usually also be red in these situations. So remember the areas of the tongue, their corresponding areas, and the corresponding, organs. So you'll know exactly which organs are in question or have issues. Okay, grazie.
Wow, thank you very much,
Yung word po
Ma'am
natin Doc
Grazie.
doon para dun sa ano natin yung su deficient, yung swe
Yeah,
blood, yung she
sure.
excess. Kaya marunong tayo mag-Chinese.
Diba? Okay, maraming salamat. Punta na tayo ngayon sa diagnosis by interrogation, feeling of cold, although fever ang pinag-uusapan. We are still on chronic fever. Okay, continuation po ito kahapon. Blood deficiency naman that is causing the chronic fever. So, parang sinabi mo na rin, papunta rin ito ng yin deficiency, di ba? So, most likely, or almost always, there will be low-grade fever or feeling of heat in the afternoon, di ba? Then there is dizziness, tingling, blurred vision, poor memory, tiredness, depression, scanty periods, palpitations, dull, pale complexion, pale lips, the tongue is pale and thin, fine or choppy ang pulse. Okay, this fever is caused by severe depletion of blood. And since there is severe depletion of blood, there can be empty heat resulting from it. It is more common in women, and this may occur after childbirth, especially if the delivery was very traumatic. Next, we have stagnant liver qi turning into heat. Chronic low-grade fever, feeling of heat that comes and goes according to the emotional state. Remember, comes and goes. This is like the ethereal soul. This is very liver. It comes when the person is upset, volatile mood, irritability, feeling of oppression and distension of the chest, and hypochondrium, dry throat, sighing, okay, bitter taste. In fact, the bitter taste would be the whole day, as in irregular periods, premenstrual tension, red tongue with redder sides, and thin yellow coating, rapid wiry pulse. Now, this is due to liver heat generated by chronic liver qi stagnation, and this is usually caused by chronic emotional problems. So, for those who can relate out there, be careful of your liver qi stagnation turning into liver heat, then liver fire. Yun. Blood stasis, low-grade fever or feeling of heat in the afternoon or evening, still the mouth is dry, abdominal pain, dry skin and nails, yun nga lang, your complexion now will be dark. Lips are purple, purple tongue, choppy or firm pulse. Now, this is chronic blood stasis and usually related to the liver. The manifestations of dryness are due not to yin deficiency, but this is due to blood stasis, due to interactions and interchange between blood and body fluids. So remember, if you have blood deficiency, this can always lead to dryness or blood stasis as well. No, when blood stagnates for a long time, it cannot interchange. Actually, there is a very direct relationship between blood and fluids. Kaya wag masyadong magpapawis, no? So it cannot interchange with the body fluids, the blood, if it stagnates for a long time. And so there will be failure to moisten the body. Fever from chronic blood stasis is frequently seen in cancer. So check your tongues now. Okay, sana hindi purple yung tongue natin, then meron tayong chronic low-grade fever. Thank you very much.
Saka yung lips, Doc, yung kahit di nagli-lipstick, na talagang nagpa-purple po yung nagda-dark yung lips. So, stasis, sign of stasis siya, stagnation.
Ay, opo. Yes. Kaya, wag masyadong isnabin yung mga low-grade fever na yan. It's not actually fever, but they feel they feel hot all the time. So, wag i-ignore, no? Okay.
Kaya balansin ang emosyon para wag mag-liver fire, mag-stagnate ang blood, wag mag-stasis.
Totoo. Kaya proceed na tayo sa pulse diagnosis. Let's listen to Ma'am Mildred. This time, she will talk about what happened to my wait lang. Okay, I can't see the slide. What happened? Okay. Okay, there we go.
Nag-stagnate na yata, Doc.
Stagnate. Ano ba nangyari? Can you see something on the screen? Wait lang.
False diagnosis lang po ang nakalagay. The influence of drugs on the pulse.
What's happening?
Nag-stasis na yata, Doc. Hindi lang stagnation, stasis na.
Okay. May naano ko lang yung controls. Okay. Thank you po. This time, interesting na din yung topic. Always interesting naman. Yung mga, those who are on medications. Okay, Ma'am Mildred?
Magandang araw po muli. Pagpapatuloy po natin ang ating topic, the influence of drugs on the pulse. So, yung mga umiinom po ng gamot o yung mga gumagamit ng gamot. I list below some drugs and their effects on the pulse. This is not comprehensive. Rather, it is limited to only the effects I have observed in clinical practice. It should be remembered that drugs will not always have the effects listed below, as different people react in different ways to the same drug. For example, it is common for antibiotics to cause a partial feeling of the tongue, but in some patients, they tend to make the coating thick. So may ganung effect yung pag-inom ng gamot. Pag tranquilizer and hypnotics po, tranquilizers, anxiolytics, and hypnotics, or yung sleeping pills, have a definite influence on the pulse. In my experience, they cause what I call the stagnant pulse quality. See above. The tranquilizer pulse to come, as it fit as if being suppressed and seems unlike to last. It does not flow smoothly and does not have a wave. It is somewhat wiry, but it does not have the strength or the wave of the truly wiry pulse. Tingnan po natin. Pag antidepressant naman po, ito yung tricyclic antidepressant. Tricyclic antidepressant tend to cause the pulse to lose its root. That is, it becomes slightly empty. So pag umiinom po nun, hindi mo mararamdaman yung pulse at the deep level. and very slightly floating. So, kahit idiin mo, hindi mo mararamdam pa empty, pero i-release mo ng konti, may mararamdaman kang konti sa ibabaw. So, selective serotonin reuptake inhibitors, yung SSRI, antidepressant, tend to cause stagnation in the digestive system and affect the stomach and spleen. So, yun, pag iniinom po natin yung mga antidepressant. So, the stomach and spleen pulse position tends to become somewhat slippery and or wiry. Kaya dapat tatanungin natin yung kung anong mga iniinom na gamot kasi may ganung effect sa pulse. Some monoamine oxidase inhibitors, MAOIs, these antidepressant tend to affect the liver and often cause liver yang rising. So they tend to make the pulse wiry. So pag umiinom po ng antidepressant, nagiging wiry. Pag beta blockers naman po, beta blockers are probably the drug with the clearest effect on the pulse. They make the pulse low o pababagalin po yung pintig ng ating pulse, and this definitely should be taken into account. Kaya tinatanong natin kung may iniinom na gamot. Otherwise, we may conclude wrongly the patient suffer from cold syndrome. So, para hindi tayo mamali, dapat tanungin natin kung may iniinom na beta blockers kasi pinababagal po nito yung pulso. They also tend to make the pulse deep and somewhat weak. In my experience, this type of drug make pulse reading very difficult. And I almost tend to discount the pulse altogether when the patient is on beta blockers. So, sa pulse po yung nakikita, pero at least may tang naman tayo, nagsasabi din yung tang. Kaya, i-double check natin sa tang. Pag ACE inhibitors naman po, ACE inhibitors affect the kidney and make the pulse deep and weak on both rare position. So, yung pag ginagawa niya. Pag warfarin naman po, warfarin tends to make the pulse relatively overflowing and slightly empty at the middle level. Okay. Pag diuretics naman po, umiinom ng diuretics, tend to make the pulse slightly empty at the deep level. They may also affect the kidneys and make the pulse very weak on both rare position. So, yun ang po sa diuretics. Sa H2 receptor and antagonist, this drug tends to affect the stomach and spleen and make the right middle position slightly floating empty. Pag nag-i-insulin naman po, yung may mga long-term use of insulin, make the pulse slightly slippery but hollow. So, pag may mga iniinom pong gamot, dapat po nating i-check. Hindi natin pwedeng basihan yung pulse kasi binabago ng gamot. So, kailangan itulong natin yung tang plus yung ating mga interrogation. Saka history. Okay, thank you po.
Thank you very much, Ma'am Mildred. Next, we go to differential diagnosis. Good afternoon po ulit, Ma'am Nitz. She will talk about liver yin deficiency.
Good afternoon, Dr. Thor. Good afternoon, everyone. How's my audio though?
Yeah, it's
Hello?
okay.
Okay naman. Okay.
Parang
Welcome
layo
to
mo, ma'am.
our... Ha? Nawawala?
Hindi parang
Okay
malayo
naman?
pa. Ilapit mo pong konti.
Ayan, ma'am. Welcome to our TCM Foundations number 182, liver yin deficiency. So, liver yin deficiency is an empty heat pattern arising from liver blood deficiency or kidney yin deficiency. Okay. Etiology or causes, a diet lacking in nourishment, excessive use of drugs, chronic illnesses, too much sexual intercourse, and overexertion. Okay? Underlying and or accompanying pathology, kidney deficiency, liver blood deficiency. It may allow yang to become hyperactive and even wind to steer internally. Okay? Signs and symptoms, dizziness, headache, blurred vision, visual floaters, dry eyes, poor night vision, So makita mo puro halos sa eyes yung symptoms. Scanty menstruation or amenorrhea, numbness and tingling of the limbs, insomnia, dull pale complexion, with redness around the cheekbones, muscular weakness, cramps, brittle nails, and very dry skin and hair. Also, there is depression. When you palpate the pulse, it is floating or empty. Okay? Ang tongue, kapag tiningnan mo sa patient, ay maybe normal in color and filled. Okay? Treatment principle, enrich the yin, nourish blood. Acupuncture treatment, we're going to use points, bladder 17 with moxa, supplements the blood. Bladder 23 supplements kidney to produce the yin. Spleen 6 regulates liver, nourishes the yin. Stomach 36 nourishes the yin and blood. Kidney 6 nourishes the yin, clears empty heat. Bladder 20 supplements spleen to produce blood. Liver 8 nourishes liver yin and blood. Kidney 3 supplements kidney yin. Ren 4 or CV4 nourishes the kidney yin. And also, we're going to use the extra point, Yuyao. It benefits the eyes. Tingnan na lang po natin sa Google kung ano yung mga points na kung saan ng location. Okay. Ang technique ay with supplementation. Okay. For ascendant liver yang, you will add DU20, gallbladder 20, and gallbladder 43, and kidney 1. Yan po. Thank you very much. I hope you learn po.
Yes, thank you
Thank
very
you.
much, Ma'am Needs. That was very helpful indeed. Maraming salamat. Punta naman tayo ngayon sa acupuncture patterns and practice. And Ma'am Rama will continue where she left off yesterday. Good afternoon po, Ma'am Abigail. Ma'am Agatha.
Good afternoon, everyone. Okay, here we go with acupuncture patterns and practice regarding vomiting, part 2. Okay, so let's go to the key points of analysis. Deficiency versus strength, or deficiency versus excess, of course. Vomiting is an illness of strength, vomiting in an illness of strength tends to have a short course and occurs abruptly. Okay, acute. The volume is usually large, and the vomitus usually contains much acid or malodorous content. So, the odor is not nice, mabaho po. The pulse is usually replete and forceful. Vomiting is an illness of deficiency, on the other hand, tends to have a prolonged or an intermittent course. So mahaba siya for ilang days siguro, and you cannot tell when it will come out again. The volume is usually small, and the vomitus usually is unbearably acid or foul. So syempre mas mabaho, mas matagal and kind of acidic. So with the taste of acid as well. The pulse is usually feeble and forceless. So mahina. Keep in mind, however, that an illness of strength can transform into one of deficiency and vice versa. And that mixed deficiency strength illnesses are also common. So they can be interchanged. So sometimes you start off with acute, and then biglang magiging of deficiency, yung hindi mo na alam kaya nalalabas, pero ilang araw kang may sakit, and then it becomes again strength na marami and, abrupt biglaan. Okay? So quality of vomitus. Acid, fetid, and foul vomitus is typical of vomiting due to food retention. So matagal na imbak ang food inside the stomach. Bitter yellow fluid is typical of vomiting due to heat in the gallbladder. Acid green fluid is typical of vomiting due to heat in the liver. Turbid sputum or saliva is typical of vomiting due to phlegm rheum. Clear fluid is typical of vomiting due to cold or insufficiency of the stomach. Small amounts of sticky foam are typical of deficiency of stomach yin. So let's go to acupuncture treatments. Strength illnesses. exogenous evils attacking the stomach. The principle is to dispel the evil, release the exterior, dissipate the turbid, and settle the stomach. So select the acupoints LI4, CV12, stomach 36, and PC6. Apply the reducing method, since this is an excess, right? So you apply the reducing method. At zone 1 or LI4, following needling, apply moxibustion. So you can apply moxibustion, or it is recommended that you do moxibustion. If treatment at these acupoints is not effective and the illness worsens, apply acupuncture to the acupoint EXHN12 or Jin Jin Yuye. Prick to induce slight bleeding. Okay, so you need to slightly bleed it to reduce the strength or reduce the excess. Palalabasin siya. Okay, let's talk about food retention. The principle is to promote digestion and settle the stomach. Select the acupoints CV12, stomach 36, spleen 3, and spleen 3. The following acupoints are held in reserve to use if necessary. CV11 and spleen 4. At these acupuncture points, apply the reducing method. So again, it's an excess condition, so we reduce, right? So interior blockage by phlegm room. The principle is to warm the middle jiao, dissipate phlegm room, settle the stomach, and suppress the abnormally risen qi. Select CV12, PC6, stomach 36, and stomach 36. The following acupoints are held in reserve to use if necessary. CV11 again, liver 13, stomach 21, and stomach 40. Moxibustion is applied after needling because it's phlegm or mamasa-masa, so you need to dry it up. So let's talk about liver qi attacking the stomach. The principle is to unblock the liver, relieve stagnation, settle the stomach, and suppress the abnormally risen qi. Select CV12, stomach 36, and liver 3. The following acupoints are held in reserve to use if necessary. Liver 14, liver 13, and spleen 4. At these reserved acupoints, apply the reducing method. Again, it's a reduction method. So let's go to deficiency illnesses. So kanina po, it's all about excess. Now we go to deficiencies. Deficiency cold in spleen and stomach. The principle is to strengthen the spleen and settle the stomach. Select CV12, liver 13, stomach 36, and stomach 25. Apply the reinforcing method and add moxibustion. Again, this is a deficiency, so we kind of tonify or reinforce. Okay, and you can add moxibustion because it's cold, right? So deficiency of stomach yin. The principle is to nourish yin and settle the stomach. Select CV12, stomach 36, spleen 6, spleen 4. Apply the reinforcing method without moxibustion because it's stomach yin. So there is kind of a deficiency of, it's a deficiency, but it's hot, right? So you don't need to use moxibustion. It's already hot. So it's a deficient heat. So let's go to this case study. The patient was an adult male who had chronic gastritis. For 5 days, he had relapse of his condition with epigastric pain and anorexia. On the day of consultation, vomiting worsened, producing thin fluids and saliva. It was accompanied by intermittent nausea, stickiness, and bitter taste in the mouth, slightly yellow urine, and watery feces. His tongue was dark purple, with white greasy coating covered by yellow. His pulse was small and slippery. So the diagnosis, chronic deficiency of middle jiao yang with strong cold in the interior. The relapse was precipitated by intemperate diet, causing injury to the middle jiao, so that cold and retained food interact and give rise to heat and impairment of the stomach functions. Again, cold can turn into heat, too much heat can turn into cold, right? So that's just the yin and yang of things, how things go. So let's talk about the therapeutic principle. Warm the middle jiao, dispel cold, regulate qi with acrid herbs, complemented with bitter herbs to drain downward and relieve stagnation. Thank you so much.
Thank you very much, Mom Agatha. Okay, so from acupuncture patterns, let's go now to symptoms and signs. Okay, we're going to take a look at the possibilities of every time this type of symptom would crop up. So for today, we're going to talk about bleeding gums. The first consideration would be deficient spleen qi not holding blood. So aside from bleeding gums, there will be poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity. Tongue is pale, empty pulse. Acupuncture point, spleen 3, REN 12, bladder 20, LI 4, and LI 7. Next consideration for bleeding gums would be combined full empty. Stomachache deficiency with empty heat. So there will also be dry mouth and throat, especially in the afternoon, thirst with a desire to drink in small sips, dull or burning epigastric pain, feeling of heat in the afternoon, constipation, having dry stools, feeling of hunger but no desire to eat, slight feeling of fullness after eating, night sweating, 5-pound heat, bleeding gums, red tongue or red center only without coating in the center, floating empty and rapid pulse. Acupuncture points, REN 12, stomach 36, spleen 6, LI 4, stomach 44, and LI 7. Next, we consider also stomach 5 when we have bleeding gums. And this time, there will also be pain aside from bleeding gums. Foul breath, intense thirst with a desire to drink cold liquids, burning epigastric pain, mental restlessness, dry mouth, mouth ulcers, bleeding gums, dry mouth, dry stools, sour regurgitation, nausea, vomiting soon after eating, feeling of heat, tongue is red with a thick, dry, dark yellow coating, pulse is deep, full, rapid. Points, stomach 44, LI 4, LI 7. Other patterns, kidney deficiency with empty heat. So this time consider, this is the usual picture that you see in elderly. Okay, dizziness, tinnitus, vertigo, poor memory, deafness, night sweating, dry mouth at night, 5-palm heat, feeling of heat in the evening, malar flash, menopausal hot flashes, thirst with desire to sip fluids, lower back ache, ache in bones, nocturnal emissions with dreams, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, depression, anxiety, insomnia, excessive menstrual bleeding, red tongue without coating, and the pulse is floating empty and rapid pulse. So thank you very much for your attention. Let's now go to the last topic, asthma. We call on Ma'am Mildred to give the presentation. This time she will start with the first case history. Good afternoon ulit, Ma'am Mildred.
Good afternoon po muli. So, asthma. Case history number 1, number 25 na po tayo. 25. Case history. A 35-year-old woman had been suffering from eczema since she was 3 months old. So, ang tagal na, no? Over the years, she used all sorts of steroid creams. She had 3 children, and during each of her gestation, Her eczema was always worse in the first 3 months of pregnancy. So bumabalik pag nagbubuntis siya. Better in the last 6 months and worse after childbirth. Pagkapanganak, mas malala. It was mostly on the limbs and face, around her mouth. It consisted of papules, red spots that were very itchy. Then they turned into pustules and ooze a liquid. She had also been suffering from asthma since the age of 3 after pneumonia. Her wheezing attacks were triggered by dust, house dust mites, animal fur, dairy product, and shellfish. She also suffered from high fever, seasonal allergic rhinitis. So, puro talaga yung lungs ang may problema kasi yung skin. Yan, lumalabas sa kanya ano. Okay. Next slide po. She occasionally had mild tinnitus. Her pulse was unremarkable, only slight weak on the right front and the left rear position. Her tongue was also unremarkable, with slightly swollen side. This is a good example of how the tongue is often remarkable in patients with atopic asthma. Seemingly, confirming that wind and not phlegm is the main pathological features of asthma. So, wind po yung nakikitang pinagmumulan. So, hindi yung phlegm. So, diagnosis, asthma, seasonal allergic rhinitis and eczema from lungs and kidneys, defensive Chi system deficiency from birth. So, dahil mula nung pinanganak siya, kaya involve yung kanyang Jing essence na nasa kidney. Kidney essence affecting the lung, corporeal soul, that in turn affected the skin. So, weak yung kidney essence, kaya sa cycle po ng Sheng cycle, pumunta rin sa lungs. The kidney deficiency is also clearly shown by the aggravation during the first month of pregnancy, amelioration in the last 6 months, and again, aggravation after childbirth. The relatively normal pulse and tongue show that the kidney deficiency involves only the kidney defensive Chi system and not other aspect of the kidney function. Kasi alam naman natin na pag nagbubuntis nga ang babae, ang nagagamit ay ating kidney Jing essence. So yun. The eczema is of the chronic damp heat type, the eliciting of asthma attacks from certain food points to large intestine heat. Yun na. Apektuhan. So, yun po yung tongue of the patient with eczema during the lung and kidney defensive Chi deficiency. Swollen po siya, no? Kitang-kita natin, no? Tapos heat. Treatment principle, her main problem at the time of consultation was the eczema rather than the asthma, the attack of which were quiet and frequent. The principle of treatment adapted was therefore to clear wind and the skin. Kasi nga eczema yung una niyang problem. So resolve damp, heat, cool blood, tonify the lung and kidneys, defensive Chi system, and stimulate the descending of the lung Chi. So ang acupuncture pong gagamitin ay ang lung 7, kidney 6, kidney 16, kidney 3, bladder 23, large intestine 11, spleen 10, spleen 9, bladder 13, and do 12. So yung mag-expel po ng wind at saka magpapalakas ng kanyang kidney and lungs. So, magtutonify. So, explanation po yun. Lung 7 and kidney 6, magtutonify po ng lungs and kidney. So, benefit the essence of the corporeal soul. Pag tinusukan mo po yun. At inonourish din po niya yung skin at mag-stimulate ng descending of the lung Chi. Ang kidney 16 naman po at kidney 3 and bladder 23, tonify the kidney defensive Chi system. Kidney 16 also benefits the essence and therefore act at a deep level to correct the inborn deficiency of the kidney deficiency Chi system. Kidney 16 po yun. So deep level po yung ito-tonify niya. In a way, it is the acupuncture equivalent of herbal use of placenta and umbilical cord for asthma. So yun po yung equivalent niya, no? So, pag large intestine 11 and spleen 10, siyempre special points for the blood ang spleen 10, at ang large intestine 11 ay siya ang earth point. So, ikukul ang blood and clear heat from the skin. Spleen 9, resolve damp heat. Bladder 13 and 212, magtotonify po sa lung, defensive Chi system. So, after 9 months po ng treatment, mostly with the herbal medicine and infrequent session of acupuncture treatment, this woman eczema clears up almost completely. Yun, ganun ang effect sa kanya. Thank you po.
Thank you very much, Ma'am Mildred. I hope everybody learned a lot today. We would like to thank our presenters and of course our attendees for joining us today. Good afternoon po.